Hello viewers. So today's topic is something very interesting. The topic is regarding insulin resistance. So in my previous episode somewhere I have already mentioned regarding insulin resistance, but I am also going to tell you something more about insulin resistance and the factors behind it and how we can identify it in the early stages so that we can prevent this insulin resistance from progressing and we can prevent the associated disorders, etc. So this insulin resistance is something which comes because of metabolism and also because of the lifestyle and a genetic background. There are many causes for this insulin resistance to come into. What is insulin resistance first? Insulin resistance is something when the insulin in the body cannot go and act on the cellular level to give the effects of the insulin. So in that case, the insulin will not act properly on the body and the body will have more of insulin just lying dormant without acting, and the body will have more insulin, that is hyperinsulinemia. So this insulin which is there in the body is going to cause more number of harm than the insulin which is not going to act on the body. The insulin which is not acting on the body is already hampering many of the regular metabolisms which should happen in the body, and in the other aspect there is a lot of insulin which is going on increasing in the body, and that insulin is going to cause more of the problems. So what are the problems which can happen because of insulin resistance? So insulin resistance, as we already know, it can lead to type 2 diabetes mellitus. It can also cause dyslipidemia, cholesterol level variations. It can reduce the good cholesterol and it can increase the bad cholesterol, and it can also cause heart attacks like atherosclerosis because of atherosclerosis. It can also cause cardiomyopathy, and it can also cause many other heart failure. It is also linked with heart failure as well. And when coming on to the bone, it can cause destruction of your bone like osteoporosis, or knee joints like osteoarthritis. It can reduce your testosterone levels in males, leading to infertility, and it may also lead to gout, which is high uric acid content in the body, and it can also have many other impacts on general body mechanisms. So it is also linked with many of the complications of diabetes like retinopathy, neuropathy, nephropathy, and many things like that. So this insulin resistance is something which we should target it properly, and it should be managed very well for any person who is having this. So what are the identification features which can help us or which can give us a clue that we are having some insulin resistance in our body? So a person with insulin resistance will have obesity. So when coming on to obesity, how do we know whether we are obese or not? So there is something called waist hip ratio or waist circumference. So if the waist hip ratio is more or the waist circumference is more, then it is an indicator of insulin resistance. So what is this waist hip ratio? The measurement at the level of the waist and the measurement at the level of the hip. That is, if the waist measurement and divided by the hip measurement, if it comes more than a particular value, then that is considered to be significant of obesity. For example, waist circumference of greater than 102 in men and greater than 88 in women is considered as obesity, or maybe an increased abdominal obesity in proper words. And in other words, the waist hip ratio of greater than 0.9 and in men and maybe 0.8 or 0.85 in women is also considered significant of abdominal obesity. This is something which we can find out without any investigations, without any blood tests. Just by measuring the abdominal circumference we can find out whether they are having obesity or not. Next thing is measure the BP. If your BP is elevated, blood pressure is elevated, say greater than 130 by 85 or greater than 140 by 90, if it's on the higher side, then there is a chance that you are having insulin resistance. Many of the people with insulin resistance will also have a mark around the neck, that is a black mark with striations around the neck, that is called acanthosis nigricans. If there is acanthosis nigricans, then also there is a clue that you are developing insulin resistance or you are already having insulin resistance. People with insulin resistance will also have variation in their lipid levels. Their triglyceride levels will be high, it will be more than 150, their HDL levels will be low, and their LDL levels will be high. So these people will be having markers of lipid problems in their body. For example, people will be having some lipid tags, or something with in the eye, lipid deposition, fat deposition in the eye, in the cornea, and even in the body with few markers we will be able to identify if they are having insulin resistance or not. Few people can also have increase in uric acid levels if they are having insulin resistance. So these are few features by which we can find out if a person is having insulin resistance or not. So suppose you are having insulin resistance, how can we reduce this, or how can we manage this? Insulin resistance can be reduced with proper diet restriction and with adequate exercise, and if needed, proper medications. A proper diet which is low in carbohydrate is necessary to reduce insulin resistance. Definitely carbohydrate is necessary for our usual metabolism or day-to-day activities, but more of carbohydrate is, or more of glucose is going to produce more of insulin, because the high amount of glucose which we are taking will stimulate the pancreas to secrete more amount of insulin. So indirectly the insulin is going to increase, and the body is already having insulin resistance, so it is going to only worsen. So suppose if you are taking a low carbohydrate diet, the insulin levels will also not go up high, and your weight will also reduce, which will also help in insulin resistance reduction. So next comes is the exercise. As I already told you, exercise helps a lot in activating the insulin receptors or in reducing the insulin resistance which is happening at the receptor levels. So because of good exercise or a daily good exercise, the insulin resistance can also be reduced. And as we know, there are also medications which can also reduce the insulin resistance, or which can increase the insulin sensitivity, in other words. So insulin resistance is something which is very crucial, or which is very important to be managed in today's culture or today's lifestyle, because it is mostly happening because of lifestyle problems rather than the genetic problems. There are also many genetic conditions which can produce insulin resistance, but that will be presenting from a very young age, or maybe even from birth. So those people, we cannot manage them much with diet restriction or things like that. But when it comes due to lifestyle properly, or whether it because of the behavior problems, we can always control it very well with our diet and exercise and with medications. The ones with genetic problems may be able to control with on a milder basis with diet and exercise and things like that. But the other thing which we are self-inducing and we are causing harm to the body, it is always in our hands to reduce our insulin resistance and to lead a very healthy life. So in this episode, I have briefed you regarding what is insulin resistance, what are the possible side effects or consequences of insulin resistance, and how we can manage that in a short way. In our further episodes, I will be dealing more with insulin resistance and the foods which we can take to reduce our calorie content and things like that. So please stay tuned to our videos, subscribe to our channel, share our videos, click on the like button if you like this, and don't forget to hit on the notification all button so that you get regular updates. Stay healthy. God bless you.